At Portsmouth Hospitals Trust, we took the decision to review our anticoagulation services. With an increasing number of patients needing anticoagulant medication for a range of conditions, and with a potentially significant impact on daily life, this was an important area to prioritise. And with a changing landscape in terms of medication, the time was right to have a rethink. So we decided to hold an event to speak to patients to find out what matters most and ask how we could improve, to help us design our services better and start an ongoing conversation that will allow us to shape the future together. So we asked what it feels like to be told that you need to be on anticoagulants.
When I was first diagnosed to have warfarin, I had no one to speak to outside the NHS, and that would have been very nice to have met someone else who was on it.
Patients shared their stories and personal experiences, which included everything from shock and fear to the peace of mind of finally knowing, teaching us not only about that individual, but that each patient is an individual, and that our services need to have the flexibility to respond to differing needs.
At first it was shock, but also relief, because it meant that I wasn't suffering with pulmonary embolisms and deep vein thrombosis, so whatever medication they gave me was fine.
In the beginning, it felt like a death sentence because I thought this is for the rest of my life. But as time goes on, you get used to it and it becomes a routine, so it becomes part of your life.
Then we asked about the impact on daily life and, again, the stories told of the variety we see in clinical practice, with changes to diet and physical activities, to feeling healthier and the burden of regular pills and blood tests.
The only thing that I'm always very aware that if I cut myself, I could most probably bleed quite well. And as an avid gardener, I'm always a little bit conscious, so I now have to garden with gloves on, which I hate. But other than that, as I said, it's become part of my life now, so it fades into the background after a time.
I now find that I have to have the tests done every 2 weeks because that is the protocol, and I find this rather imposing.
What really helped was understanding what patients thought we could do differently, with a big focus on better information and ongoing education on what to expect, side effects, diet, and on how life might be different. The case for change was clear. Patients also mentioned the need for better communication between hospital departments and with GPs. Having the opportunity to meet others in a similar position was also really popular.
I would like to invest in an INR machine, which means it will stop me from coming here every week or 2 weeks, which I've been doing for quite some time. That's what I think would be a good idea.
When you get older, like me, it doesn't stay in your head, so it would be nice to have it written down so that if you forget something, you can look back in time and say, that's on page whatever, and you can refer to it again.
So the information we gathered is just the start. We want to understand our patients better and recognise each person as an individual, so that we can create a service that is flexible and responsive to their requirements. The needs of the patients in Portsmouth are individual, but for those needing anticoagulants, the themes are universal. We want to keep refining what we do to give the best possible care to our patients.